Deandra Smith. Deandra, welcome to the show.
Thank you for having me.
Your first time here.
Yes,
Great to have you here.
I'm glad to be here, even though I feel like I'm about to have a cough. Pardon
Go
me.
ahead, cough away. No, that's fine. While you have a cough, I'll remind viewers that it's an important month. One of the reasons we wanted to have you here this month is that it's World Blood Donor Day this month and Sickle Cell Day.
Yes.
So what is the American Red Cross's concern with sickle cell anemia?
So with sickle cell, a lot of the patients, some of the patients can go through 100 pints of blood in 1 year.
Wow.
So when you donate blood, you donate 1 pint. Unless you do a power red, then it's 2 pints. But when you think about it, a single patient needing 100 pints of blood in 1 year, we said we had to do something. We had to make sure that blood would be one less thing for sickle cell patients to worry about.
So what is sickle cell disease?
So it's a inherited blood disorder, whereas your blood cells, normal people blood cells, are round and they're soft and squishy, and they live for about 120 days. People with sickle cell, their blood cells are shaped like half moons, and they're hard and they're sticky. They only live about 15 days. And so they die off faster. They have trouble carrying oxygen to the rest of the body, so you have organ damage. You have a higher risk of stroke. You have bone complications. Anywhere the blood flows, if those sickle cells get caught in a vein, it causes excruciating pain.
Oh, wow.
And not pain that you take a Tylenol or a Motrin and you go to bed. This is pain that will keep sickle cell patients in the hospital up to 2 weeks. They are on high dose pain medicines to just have comfort. Sometimes they can't even walk if the blood get caught in the legs, or they can't hold things if their blood cells are caught in the hands. Anywhere the blood flows, if it gets stopped, it can be painful.
So it's a chronic condition that
Yes.
it can be managed.
It can be managed. It's a lifelong condition. It definitely can be managed. And the biggest thing is blood donation. So you have the power, blood donors have the power to helping with the quality of life for sickle cell patients.
And sickle cell only affects Black population.
So it can affect any population because it's a genetic disease. However, it's more prevalent in the African American population. But then the second highest population is the Latino Americans. Then third is Mediterranean. But I myself have sickle cell.
You do?
Yes. And last year I needed 12 pints of blood. And I was sitting there as I was getting my blood transfusion, and I said, I would have needed 12 donors. And I just recalled in my head the various faces I've seen donating blood.
When did you know that you had sickle cell?
So I was diagnosed at 2 years of age. Back then, they weren't doing mandatory testing, so my family didn't find out until I was 2. Nowadays, they do mandatory testing at birth. They do genetic testing beforehand, so parents are more prepared now. But back then, my mom said, and I don't know if this is a good thing, said she always knew something was wrong with me. But, she finally found out that it was the sickle cell.
Are there other people in your family with sickle cell?
Unfortunately, I'm the only one with the disease.
Huh.
So it's a 1 in 25% chance that if 2 parents have the trait, that a child will have the disease. My siblings have the trait, but I'm the only one with the disease.
No cure?
No. So they've come out with a new genetic cure, but it's not a universal cure.
Have you checked into what your...
I have. And at this point in time, I'm not a perfect candidate.
Oh, shoot. But they are making advances.
Yes.
And so there's possibility that as they continue their work, it could be something that you would be able to benefit from.
Yes.
So sickle cell, everyone needs to be donating blood for all the reasons we know about, but I bet a lot of people had no idea the need for sickle cell patients was so high.
Yes. A lot of people ask me, I hear about the pain aspect of sickle cell, but they don't know that managing the blood and getting more healthy blood in the system and less sickle cell or sickle blood, it helps manage pain. And so a lot of people are on blood therapy, a lot of patients. And like I said, so some patients may have to do blood therapy twice a month. They might do it once a month. And with that, pediatric patients, they get 5 to 8 pints of blood, and adult patients get 8 to 10. And just depending on how often they need that blood, you see, it's going to add up.
So you've lived with this your whole life. And the pain, so does it just hit all of a sudden?
All of a sudden. But, pain is a big aspect of it. But the older I've got, I know how to manage my pain. It's the other things. I've had 2 reconstructive knee surgeries. I've had my gallbladder taken out at an early age, pancreas issues, spleen issues. I'm partially blind in my right eye. Because of sickling behind my eyes, I actually have to have cataract surgery next week.
So the blood is doing this to all your organs.
Anywhere the blood flows, those sickle cells, they wreak havoc some days.
Yeah. This is the time of year people are traveling, school's out, the donations drop.
They drop drastically, and we always say, roll up your sleeves. And with it being World Donor Day next week, this Saturday, we just want to not only thank the millions of volunteers around the world for rolling up their sleeves, but asking people to come on out and donate more.
Yeah. Is this you? Is this your poster?
Yes.
Oh, nice. So you're speaking at an event. You're an advocate for people to donate blood. Now, Black blood donors are more crucial to sickle cell patients.
Yes.
How so?
So 1 in 3 Black blood donors is a match for a patient living with sickle cell, because it goes beyond just the type of blood. It goes beyond A, B, O negative. It goes to the antigens that's on the blood. And the antigen that we look for is the negative CEK antigen. And 1 in 3 African American or Black donors have that antigen.
So it's even more important
Yes.
for Black donors.
Yes. And I always say, because I cover the entire state of Michigan and I increase diversity, whether you have sickle cell, cancer, you're a mother giving birth, blood is almost like insurance. You want to have it, in case you need it. And so we always want to have blood donors for anyone who needs it.
Yeah, blood donations are down in the summer, plus the need is up.
Yes.
Well, we hope that we've inspired some of our viewers to make a donation. World Sickle Cell Day is June 19th, but a few days before that, this Saturday, it's World Blood Donor Day.
Yes.
There you go. Watch for a blood donation drive near you coming soon. Great to have you here.
Thank you for having me.
Yeah, good luck with the management of your sickle cell disease.
Thank you.
Let's hope that the gene therapy that they're working on is going to help you someday too.
Thank you.
Nice to meet you.
Nice to meet you as well.
Deandra Smith is sickle cell blood account manager at the American Red Cross.